Good afternoon, everyone. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Welcome to our Friday, May the 15th press briefing. We are now at the end of week 10 of the coronavirus being here with us in Montgomery County. Since our press briefing on May the 14th, we have received a report of 120 new cases of COVID-19 in Montgomery County, which brings us to a total of 5,642. Today, 36 of these cases are from long-term care facilities, 3 are from the Norristown State Hospital, and 81 are from the community. These positive individuals are from 32 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 10 years old to 104 years old. And as always, you can check our county municipal maps at montcopa.org/COVID-19. Today we have 72 females and 48 males. 10 are known to be hospitalized, 13 are in isolation and at home, and we do not have information on 97. I'm also saddened to confirm that 13 more Montgomery County residents have lost their lives to COVID-19, which brings us to 467 deaths confirmed positive from COVID-19. 6 were known to die in the hospital, 3 at a facility or home, and 4 we do not have information on. They ranged in age from 59 to 104. Since the pandemic began here, 256 females and 211 males have died from COVID-19. The self-reported racial breakdown, as we have it, is 12 Asian, 3 Asian Indian, 3 Asian Korean, 44 African American or Black, 117 white, and 288 unknown. Today, we do not have information on probable deaths. Our hospital bed update, we are continuing to see a slow but steady reduction in hospitalizations, which is great news. Today, the number of hospitalized patients remains in the high 200s. This is, of course, patients hospitalized with COVID-19, and 33% of those patients require ventilators. Our long-term care facilities continue to be challenged by COVID-19. Today, we have 94 facilities that are reporting positive cases among their staff and residents. Since this pandemic began here in the county, these facilities have reported to us a total of 1,634 cases among residents and 595 cases among their staff, for a total of 2,229 cases. Just a reminder, not all of these individuals are considered Montgomery County residents, so those numbers do not tie to the numbers I reported at the beginning of this briefing. 407 of the 467 deaths confirmed positive here in Montgomery County are individuals who are at a long-term care facility, and that is approximately 87% of the total confirmed positive deaths. We continue to do outreach to these facilities. Our FAST teams will be making some repeat visits to some facilities next week, as well as some new facilities. These visits continue to go extremely well. Some of these facilities have asked us to return to go over some additional issues and make sure that they are doing things as well as they can. And I'm also pleased to know that a number of facilities are pursuing testing for both their residents and in some cases their staff. So we are working with the Pennsylvania Department of Health to try to assist in connecting these facilities with resources to get that testing done. At our Montgomery County Correctional Facility today, the report is that all is stable. We've had no new inmates identified with COVID-19, and all of those that have tested positive are currently stable. Our community testing sites remain busy. Our Norristown site was up and running today. It will be closed for the weekend and will reopen on Monday. Now, starting Monday at the Norristown site, the site has expanded their criteria to include all residents of Norristown Borough, as previously was the case, or all residents of Norristown Municipality, and all established patients of the Delaware Valley Community Health Center, regardless of the municipality in which you reside. So again, beginning Monday, all residents of Norristown Municipality, as well as any established or current patient of the Delaware Valley Community Health Center, is welcome to be tested. Appointments can be made starting at 8:30 in the morning by calling 610-592-0680. That's 610-592-0680. And they will be doing testing between 11 and 1, Monday through Friday next week, weather permitting. The drive-through site at Montgomery County Community College is also open and running smoothly today. Thanks to everyone involved at the community college and at Whitpain Township, the National Guard, who's been phenomenal, and several county departments who are helping with that testing. For the dates of April 16th to May the 12th, 5,116 individuals have been tested, and we have received results on 4,981 individuals, which represents 97% of the total. 670 of these individuals have tested positive. So for 22 days of testing, we are running now 13% positive. As a reminder, this site will be closed tomorrow, Saturday. We are closed tomorrow for a safety stand down so the team can take a break, but they will be open on Sunday at 10 a.m. Appointments for Sunday will open at 8 a.m. Sunday morning. Appointments can be made online at moncopa.org/COVID-19 and clicking on the green County Testing Information button. Or also starting at 8 a.m. Sunday, you can call 610-631-3000. Now, wanted to clarify one particular issue. We have received a number of questions about the use of antibody test results in our reporting of cases. Antibody tests are not considered a confirmatory test for COVID-19 at this time. Therefore, there are no antibody results in the positive test results that we share with you each day. As a reminder, the antibody test is like looking in the rear view mirror. This test can tell us if a person has had coronavirus and recovered enough to develop antibodies. In most cases, it cannot confirm whether or not the individual being tested has coronavirus right now. So because of that, these results are not included in the positive case numbers that we share with you each day. Now, I just wanted to remind everyone as we head into the weekend of our positivity graph, which we showed yesterday for the first time recently. And just want to highlight for you the fact that our numbers are moving in the right direction. So as you contemplate what you're going to do during this beautiful warm weekend, please remember that we are finally turning the corner and we are finally starting to see our case numbers drop in meaningful ways. And so please take responsibility for your actions this weekend. Try to limit your trips to essential trips. If you're outside enjoying the weather, please wear a mask. And please be mindful of social distancing and staying at least 6 feet away from anyone that you encounter on a walk or a jog or a bike ride. So as a reminder, this graph shows each day of testing at our drive-through testing sites. The original one in Upper Dublin and the more recent one in Whitpain at the community college. It shows the number of people that tested positive on each day of testing. I just want to emphasize one more time that this downward trend that we're seeing is the result of many, many weeks of personal sacrifices that all of you have made. And I just want to thank you for that. Because of your actions, we are starting to meaningfully reduce the number of new cases in our county. But we still have a lot of virus in our midst. And because of that, these numbers could quickly change. So to illustrate that, the black dashed line shows our 14-day average over the past 14 days, which is running over just 13%. And that's the number of people who test positive on any given day. We're a little over 13% for the last 14 days. The red line is what could happen in a week if we stopped any social distancing. So one person of the 13% out there that are positive, if they infect 2.5 people, and then those individuals infect 2.5 more people, within 5 days, we could be looking at a positivity rate approaching 33%. That's how quickly this can change. The green line, on the other hand, is what happens if we continue with our strict social distancing. Under that scenario, one person infects less than another person over several days. And so 5 days or a week from now, we would actually have a lower positivity rate. We would project it's about 8.3%. So we still need to get these numbers down a little bit lower, and your cooperation with all of these social distancing guidelines, wearing masks, frequent hand washing, staying 6 feet away from others, all of these steps that we've been taking, that's what's going to get us there. So thank you so much for your cooperation. I know it's hard, but we're moving in the right direction. And with that, I'm going to turn over to Commissioner Lawrence.
Okay, good afternoon. I have an update today on the Montgomery PA COVID-19 Response Fund, which was established on March 26 and is being administered by the Montgomery County Foundation. As of Wednesday this week, $600,000 has been raised or committed for the fund. This is up $80,000 from my last report. $100,000 has been raised from individual citizens. I'd like to thank all of our local foundations, businesses, and private citizens who have contributed. As of today, 101 local safety net organizations and first responders have been awarded $322,000. The fund is reviewing another $68,000 in grant requests in the coming week. This is a community-wide effort to support the immediate needs of residents hardest hit by the pandemic. Grants of up to $5,000 are being reviewed and processed on a rolling basis. Projects are prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the project targets particularly vulnerable populations. Grantees so far include food pantries, senior care programs, rent and utility programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchase for nonprofits who are continuing essential in-person services, navigator support, and emergency shelters. But still, more funds are urgently needed to support the ongoing efforts of our first responders and our social safety net providers. If you are able to support the need and the high demand for grant requests by making a tax-deductible donation, you can find more information at www.montgopa.org/COVID-19. You can also find a complete list of the safety net organizations that have applied for grants and received grants, and safety net organizations can apply there as well. So thank you. I want to give a testimonial. I want to read one of the testimonials that's been received from one of the grantees. Words can't describe my gratitude for the COVID-19 funding. During these difficult days, these funds will assist IHN ML to continue its mission of providing shelter to homeless families and support to prior program graduates. Due to the COVID-19, we implemented our graduate self-sufficiency case management program sooner than anticipated. Our graduates are experiencing job loss, income loss, bills that are still coming in, and the loss of childcare to even go find other employment. IHN ML is now coming alongside them, providing case management and support in the form of food, gift cards, resources, etc., as well as continuing to shelter vulnerable families differently than our program designed. This funding will go a long way to these families, and we are so thankful. Thank you. And that was from Allegra Cressman, who's the executive director of the Interfaith Hospitality Network of the Main Line. So as Commissioner Arkush mentioned, we are at the end of the 10th week here of social distancing and stay-at-home orders, and we know that it is getting harder, and that our patience is probably wearing thin. So ongoing fear, anxiety, boredom, and even anger can be wearing on your emotions. So during these frequently changing circumstances, overwhelming information and uncertainty about the future can all contribute to depression and anxiety, as well as exacerbate any existing mental health conditions. In Montgomery County, our offices of mental and behavioral health continue to offer a full range of services and programs to help citizens of all ages, anytime, wherever they are. Services are delivered through an integrated approach with the offices of mental health, drug and alcohol programs, developmental disabilities, children and youth, juvenile probation, crisis services, and other human services offices. During the COVID-19 social distancing order, online and phone support is available from several of our services. Please visit our webpage at www.montcopa.org, click on Departments, and under Health and Human Services, find online support during social distancing. For anyone with medical assistance or who does not have health insurance, there are community behavioral health centers located throughout the county that can assist you. Please call 610-278-3642 to locate the provider in your area. And as always, if you are feeling overwhelmed or having a mental health emergency, the Montgomery County Mobile Crisis Unit is available 24 hours a day, 7 days a week, and that number is 855-634-4673. With that, I'll turn it back to Dr. Arkush.
Thanks, Commissioner Lawrence. And I also just want to add my thanks to everyone who's contributed to our COVID-19 response fund. Obviously, it's having a huge impact on our community, and we are so grateful for that. I also want to let everyone know that we will do a press release tomorrow on Saturday. There will be no release on Sunday, and then we will be back here Monday at 3 o'clock. And with that, I'm happy to take any questions.
There's no questions today.
No questions today. Well, I'm not surprised. It's a gorgeous day out. So I'm imagining that there's some people getting some sun. So please have a safe weekend. Stay safe out there. Please be careful and mindful, and have a great weekend, and we'll see you on Monday. Thank you, Sarah.